What is a lumbar herniated disc and how does it occur? A lumbar herniated disc, also known as a slipped or ruptured disc, is a condition that occurs when the soft, spongy center of a spinal disc pushes through a tear in the outer, tougher layer. This can cause pain, numbness, and other symptoms in the lower back and legs. The spine is made up of a series of small bones called vertebrae, which are stacked on top of each other and separated by discs. These discs act as cushions, allowing the spine to bend and move without friction. Each disc is composed of a tough outer layer called the annulus fibrosus and a soft, gel-like center called the nucleus pulposus. A lumbar herniated disc can occur when the outer layer of a spinal disc becomes damaged or weakened, allowing the inner nucleus pulposus to push through. This can happen due to a variety of factors, including age-related degeneration, traumatic injury, and repetitive strain. As we get older, the discs in our spine naturally begin to dry out and lose some of their elasticity, making them more prone to tearing. Similarly, activities that involve repetitive strain or heavy lifting can put added pressure on the discs, increasing the risk of herniation. Symptoms of a lumbar herniated disc. The symptoms of a lumbar herniated disc can vary depending on the location and severity of the herniation. Some common symptoms include lower back pain. This is often the most noticeable symptom of a lumbar herniated disc. The pain may be constant or intermittent, and it may be sharp or dull. Radiating pain. A lumbar herniated disc can also cause pain to radiate down the legs, often following the path of a particular nerve. This is known as sciatica, and it can cause numbness, tingling, or weakness in the affected leg. Muscle weakness. A herniated disc can also cause muscle weakness in the legs, making it difficult to stand or walk. Loss of bladder or bowel control. In rare cases, a lumbar herniated disc can cause damage to the spinal cord, leading to loss of bladder or bowel control. This is a medical emergency and requires immediate attention. Diagnosing a lumbar herniated disc. To diagnose a lumbar herniated disc, a healthcare provider will typically begin by taking a medical history and conducting a physical exam. This may involve asking about the location and severity of the pain, as well as any other symptoms that the patient is experiencing. Imaging tests may also be used to help diagnose a lumbar herniated disc. These may include X-ray. An X-ray can help identify any abnormalities in the bones of the spine, but it is not effective at showing the discs themselves. MRI. An MRI, magnetic resonance imaging, is a more detailed imaging test that can show the discs and other soft tissues in the spine. It uses a powerful magnet and radio waves to create detailed images of the body. CT scan. A CT, computed tomography, scan uses X-rays to create detailed images of the spine. It can be used to help diagnose a lumbar herniated disc and other conditions affecting the spine. Non-surgical treatment options for a lumbar herniated disc. Many people with a lumbar herniated disc are able to find relief through non-surgical treatment.
Sincerely, Bosphorus Victoria Smyrna. bvsdoctors.com.
Bosphorus Victoria Smyrna. bvsdoctors.com. Healthy future.